In Halifax, the squeeze is on. More people are using disinfectants to keep the new coronavirus at bay. As a result, drugstore shelves are either low on supplies or completely sold out. New mother Teresa Bombardier is adding a layer of protection against COVID-19.
So I just walked out of there and I bought wet ones, the wipes, the antibacterial wipes for your hands. He's 1.5 years almost, and I'm, you want to be extra careful with little ones and people with compromised immune systems.
Stores that do have hand sanitizer in stock are running out fast. At this store, there were 200 containers to start the day. By noon, all but a handful were sold.
Yeah, I did buy more. Went and got a big thing at Costco of the Lysol wipes.
With liquid disinfectants becoming scarce, homemade solutions are being promoted online, like this one mixing an alcohol compound with aloe vera.
This has turned into a gel-like substance.
Disinfection control manager in Nova Scotia is confident mainstream sanitizers will kill the new strain of coronavirus, but she's reluctant to endorse do-it-yourself methods.
As long as it has that higher alcohol content, it's fine, but I'm not an expert or know about these home remedies. It's not something we certainly do in healthcare.
If sanitizers aren't available, good old soap and water provides protection too.
You try to get up to 20 seconds. We tell you sing happy birthday to yourself. That's one good tip.
There are other new tips with each passing day, including the NBA discouraging players from high-fiving with fans. But officials in Canada continue to preach good overall hygiene and common sense as the best solution. Ross Lord, Global News, Halifax.
In the Greater Toronto Area, the Transit Authority is trying to find passengers who may have traveled with a 34-year-old woman recently diagnosed with the new coronavirus after arriving from Iran. The fear, COVID-19 spreading at the community level.
We're cooperating fully with the public health authorities to help them trace the customers on that train and get information to them.
Canada has a pandemic plan that was implemented post-SARS and tested in 2009 during the H1N1 epidemic. It involves a command center with health experts to guide hospitals in case of a mass health scare.
You always want to have these things in place before there's the need, and that you're planning for that and prepared for that.
Canada's top doctor says there's a new surveillance system in place since the appearance of COVID-19 in this country.
So these are people who are, have certain symptoms, like flu-like symptoms, and it's adding the COVID-19 test to those kind of testing.
Anyone showing symptoms is being advised to call public health authorities before showing up at hospitals. But there's no way to monitor that. And here's why that's troubling.
This is a virus that can be transmitted when people have very mild symptoms. People may not know to present, and so it is quite possible that those containment measures will not work in the long run.
Is Canada perfectly prepared? Difficult to say.
Dr. Srinivas Murthy is working with the World Health Organization to track COVID-19.
Making sure hospitals are adequately staffed, making sure people know where to seek care if they need to at the public level, making sure all the supply chains are readily checked, namely masks and gloves and other personal protective equipment.
There's a run on stocks of cleaning supplies and sanitizers in case this turns into a worse outbreak. For the most part, though, Canadians are remaining calm.
Trying to not buy into the hysteria that's going on.
But it could be a matter of time before the disease isn't just one brought in through travel.
It's not improbable that more cases will be happening here, even at the community level.
And health professionals say that will be the next front in the battle against this virus. Robin Gill, Global News, Vancouver.
It's the next stage in the fight against COVID-19. Toronto area transit agencies have started disinfecting buses and trains daily to stop any spread of the novel coronavirus.
We piloted a special long-acting antimicrobial agent on a train. It was quite successful.
It's an additional measure at a time when the federal health minister continues to say the current response is working.
Federal government works very closely with provincial and territorial partners on all kinds of different technical governing bodies that help make sure that our systems are ready should we see an outbreak in any community.
They say they're ready, but they've yet to lay out a battle plan for a possible outbreak in the way other countries have. So, what's Canada's plan?
The basic plan that I understand is the pandemic influenza plan that will be adapted nationwide to deal with this.
Now, Dr. St. John helped to develop the influenza plan after the SARS outbreak in 2003. He says it's not time to implement it, but it is time to explain it to Canadians.
I think it would give people a sense that number one, there is a plan. Number two, it is a multiple component plan. It deals with the private sector. It deals with security sectors like police, fire, ambulance.
He says public health officials are trying to strike the delicate balance between informing the public and causing panic. So far, all of Canada's COVID-19 cases are travel-related, not spread within communities. And that's why some don't think the federal or provincial governments need to take possible next steps.
Each province has health protection legislation that enables medical officers of health to put a person into quarantine if they suspect that they may be developing a disease.
It's an extreme power that could be used to fight a virus which is spreading extremely quickly. Mike Lecouture, Global News, Ottawa.
This is your campaign. Just a few days ago, the press and the pundits had declared the campaign dead. And then came South Carolina, and they had something to say about it. And we're told, well, when you got to Super Tuesday, it'd be over. Well, it may be over for the other guy. Tell that to the folks in Virginia, North Carolina, Alabama, Tennessee, Oklahoma, Arkansas, Minnesota, and maybe even Massachusetts. It's too close to call. We're still waiting for Texas and California, a few other small states to come in. But it's looking good. So I'm here to report we are very much alive. And make no mistake about it, this campaign that will send Donald Trump packing, this campaign is taking off. Join us.